Dear friends, hello. Today I want to tell you about Viagra and its alternatives. It will be a very interesting talk. If you listen until the end, you will learn what complications this medication can cause and how to deal with them, because the countdown will be in hours. In this video, I will tell you how to take it properly, what side effects may occur, and how to
deal with them,
fight them, and I will detail the alternatives and their benefits since each drug in this group works differently. If you're unaware of their specific features, they simply won't work for you. I love backstories because Viagra has a particularly interesting one. In 1992, they started testing the medication to treat high blood pressure. People rarely returned the pills. Typically, when prescribed a bottle of pills, you should take them for 2 months and return any remaining pills. And people became so reluctant to give back these pills. They started to find out why, and people would say, "Can I keep them?" It turned out there was a side effect. As you know, most people with hypertension are elderly. They started having spontaneous erections and the quality of their sex life improved. And then the company saw that this was actually a really cool effect, and the side effect became the main active component. And now it's a brand. It's actually an outdated drug. It has a bunch of analogs, but to this day, its huge, so to speak, brand name, its significance, which is cemented in jokes, in movies, in cinema. When at the pharmacy, it makes you choose precisely.
Viagra and...
Indeed, the drug is quite interesting and groundbreaking. Because up until that moment, just so you understand, there wasn't a single medication that could truly and fully fix your problems. Throughout history, there have been various attempts to treat erectile dysfunction. They used to inject different salts into the penis, chew bark, and yohimbine. You know, right? Yohimbine, it's actually the bark of a tree. I think the tree is called yohimbe. It slightly increases blood flow to all pelvic organs, though the effect is not very strong. And in the past, tribes would use it before going to a woman. Or let's say before a date, they'd chew a piece of bark and their erection would get better. Then they started trying to chew testicles. I mean, the raw testicles of different animals. Then they tried making injections from these testicles, subcutaneous extracts. They tried eating them, making extracts from testicles, and not just testicles, but also from crocodile semen. There were actually a lot of different stories. Everyone had their own thing.
Did it help? And
one of those probably passive bonuses of Viagra and its invention is that animals, especially some tigers, rare ones that were killed because of their claws. I don't know. It enhanced erections, and actually a lot of animals were saved when Viagra was invented. Because before, people used to hunt all sorts of animals hoping that, well, their erection would get better. Like, I don't know, if you eat its kidney or grind its horns, your erection would improve. Now that's not the case. Who is Viagra recommended for and who shouldn't take it? It's 18 plus, according to regulations, so you must be over 18 years old. You shouldn't have kidney diseases, liver diseases, diseases of the optic nerve. You can't use it if you're taking heart medications or if you have any kind of heart condition. If you have high blood pressure, you can't use it. If you have low blood pressure, you can't use it. If you have blood problems, you can't use it. Take the side effects of Viagra seriously, because if you're taking heart medications and you combine them with Viagra, you could actually end up with a fatal outcome. So be sure to consult your doctor before using this medication. But if you don't have any contraindications, the medication is very good. There are some specific things you absolutely need to know if you're going to use it, and you should also know about the specifics of the alternatives, which I'll tell you about today. If you've heard of or used Viagra, Cialis, Levitra or Zyden, give a like. Let's continue. Watch, listen and learn. Viagra has a specific feature. If you use it while eating, for example, you go on a date, have a big lunch or dinner with a girl and decide to use it just in case, it won't work. It only works properly if you take it on an empty stomach. If you eat especially fatty food, consider it money down the drain. You just ate a candy. The same goes for alcohol, by the way. If you have a couple of glasses of champagne at a romantic dinner in the evening, Viagra will also work poorly. As one of the earliest drugs, Viagra has numerous limitations. There are alternatives like Levitra and Zyden. They are allowed to be used with fatty foods. Plus, it's very important to hit the time window when you get an erection. With Viagra, it's about 30 to 60 minutes, and the duration of Viagra's effect is about 3 to 4 hours. Planning for a 6 o'clock date can be tricky, as it's difficult to know if you should take your medication 30 minutes or an hour beforehand, which is inconvenient. Alternatives like Cialis have a milder effect that lasts 36 hours, but it takes 6 hours to start working. You can take it with fatty food, you can take it with alcohol. Levitra is a bit milder, works for a slightly shorter time, and has fewer side effects. So actually, each medication has its own specifics. And as I like to say, everyone should find their own inhibitor. Viagra might work for you, Levitra might work for your neighbor, and Zyden might work for your friend. So basically, if you have indications for using these medications, this drug is called a phosphodiesterase inhibitor. Try different ones, see how you tolerate them, see how sometimes one works and another doesn't. So when you start using them, be sure to try different options. Is there a course-based use of these medications? Yes, there is, but nowadays in practice, Cialis is most often used, 5 milligrams, a small dose every day, regardless of whether there is sexual activity or not. This is considered to have a positive effect, first of all, on the overall background. It's a good way to achieve an erection more easily and maintain it more easily. This is suitable when there is some psychological component present. In general, let's think about who actually needs Viagra. Is it only for people who are ill? Not always. In fact, nowadays Viagra is most often used by teenagers and young people who don't have any problems with erections. When they want to impress someone, people who have a fear of failure syndrome, everything works well for him, including masturbation and his regular partner. However, starting a new relationship is always a challenge. The first, second, third sexual encounters, the first few times, are very difficult for him. And in order to make it easier to get that comfort and confidence with a new partner, they sometimes use certain things. The psychological aspect is also considered. You don't necessarily have to use Viagra only if you have problems with your veins or blood vessels.
Alexander, how long can you stay on it? And is it harmful to take it for a long time?
Sit for a long time? There is dependence. I'll be honest, there is dependence. The erection on it will be a bit better than your own. Most often I've heard something different from renowned professors, but they were women, and they said that an erection on Viagra should be the same as your own. If yours isn't like that, that's nonsense. But not better. When using these medications long term, it's crucial to understand that the resulting erection may be slightly better than a natural one. And you shouldn't consider it the standard. You need to understand that yours might be a bit worse. That means the next sexual encounter will be delayed. It will be harder to achieve because it not only strengthens the erection, but also allows you to better control orgasm. By the way, one of the ways to prevent not erectile but premature ejaculation is a phosphodiesterase inhibitor. So, Viagra really will help you and its analogs last longer. Psychologically, the most important thing is to get off this medication if you don't have a disease and you're just used to it. Reduce frequency and dosage of use and gradually wean off the substance. And most importantly, you need to understand that you are a healthy person, and the fact that you feel a little worse than when you are taking it is normal. All of these drugs that stimulate erection have one, probably the most serious side effect. Well, let's not talk about the fatal one. That's obvious, even a fool understands that. There's something I've often encountered in my practice, and many urologists do too. It's priapism. Priapism sounds like a funny name, but in reality there's nothing funny about it. It's a persistent erection that isn't related to sexual activity. There was a god named Priapus, the god of fertility, and this condition was named after him. If your erection lasts more than 4 hours, you need to see a doctor immediately. It's better to see a doctor after the 3rd hour, especially if you've already ejaculated. If intercourse is over, if you have no desire but your penis still doesn't go down, that's priapism. Priapism is a pathological erection, and you might think, what's so scary about that? But it's the same as if we put a tourniquet on your arm and you walk around with it for many, many hours. Unfortunately, the help here is often very surgical. They drain the blood, puncture the head of the penis, and rinse the penis with heparin solutions and adrenaline solutions. Sometimes this helps, sometimes they have to actually cut the head and stitch it up there. So, is it serious? It is serious, and there can be consequences if you don't see a doctor in time, if you don't solve this problem promptly. This is erectile dysfunction. That means your erection will disappear in 3 weeks. In 4 weeks, acidosis develops, meaning the cavernous bodies get damaged, they stop working properly, and you end up with complete erectile dysfunction. So is it worth messing around? Well, the choice is yours. But should you stay at home if you get a side effect like priapism? Definitely not. Many of you, when you get this, when you came to our hospital and we asked why did you sit for 6, 7, 8 hours a day? Why? You said that it was embarrassing to show, embarrassing to complain about, but now you are educated, and I hope that, God forbid this happens, you will call an ambulance right away. In general, basically, Viagra, just so you understand, and this is a very important point, it does not affect your desires in any way. In a movie, possibly called March Cats or something similar, they showed someone secretly being given Viagra, and all the guys at the wedding are standing there with a tent, you know, an erection. It's nonsense. Your erection gets stronger, yes. I mean, we don't act on the cause, we help strengthen the erection, but Viagra doesn't affect your desire in any way. Many people say, well, I take Viagra and now we have sex more often. Well, it's just that when you get an erection for whatever reason, you kind of know you need to do something about it. Thinking right away that you need to have sex doesn't actually change anything. Have you tried Viagra? And does it affect your desire in your case or any similar medications? I would like you to share this in the comments, so don't hesitate to write. I think both I and our subscribers would be interested to read it.
There's an expression somewhere about female Viagra. What is it? What is it for? Does it even exist? And can you find something like that on the internet?
Yes, it exists, but officially there is no female Viagra. It's more of a marketing move. There is no official, fully functional female Viagra that works like it does for men, because the physiology of erection in men is one thing, and the physiology of sexual arousal in women is different. Basically, women have issues specifically with arousal, with sensations, not with whether the clitoris is erect or not. That's why female Viagra doesn't really exist. So don't waste your money if you decide to share your Viagra with your girlfriend. Many young people who buy this Viagra, for them it's a lot of money. Can you imagine, every time I don't know, now it's about 1,000 rubles for each sexual act? There are even special devices that split Viagra in half. In the past, Viagra was the only option and it was pricey, so men would split the pills into halves or thirds. An ad campaign claimed that the active ingredient was only in one half of the pill, warning against breaking it or it wouldn't work. In surgery, we also use it when the prostate gland, that is, the prostate, is removed. These patients are prescribed Viagra for 6 months to stimulate recovery. That is, their chance of developing erectile dysfunction becomes lower if they take the medication regularly. Viagra also has some interesting properties that not everyone knows about. Let's briefly go over them. Changing time zones helps to adjust to new time zones. Pilots adapt more easily to changes in altitude. I think they tested this on helicopter pilots. They handled the stress better. If you use Viagra, by the way, urination actually improves while taking these medications. There are many situations where this medication is effective. This once again proves to us and shows you that the body is a single whole and you shouldn't think of the penis as something separate. An erection is a thermometer of your health, your male health, so personally that's my attitude toward erectile dysfunction. Not to give you Viagra, not to give you Cialis, Levitra or any other miracle pills that will fix this problem for you. We're not addressing the root cause. My approach is to check the whole body. I send men to my program. By the way, there's a link to it in the description below this video so you can see what the body is really like. If you want to have a healthy penis that functions not just here and now while you've taken a pill, if you're having problems with erections, you need to start with a comprehensive checkup. This is essential because a healthy man should have good erections. By the way, we recently filmed a big 2-hour broadcast about men's health, and there was also a presentation of our sports project. This broadcast is linked below in the description under this video, so check it out. I think you'll really enjoy it. My friends, subscribe to my channel and you'll be the first to know about new episodes.